Hello, everyone. I'm Nick Alonge. Welcome to our fifth interview with the attitudes of dental technicians in the new norm, brought to you by WeTeamUp. My guest today is Adam Sciuk. Hey, Adam, how's it going?
Good. Thanks for having me, Nick.
Yeah, thanks for coming on. Tell us a little about yourself.
Well, Nick, I'm located here in Canada, just outside of Toronto in the Oshawa area. Long story short, I went to Brock University, graduated in health sciences. During that time, I worked for a large local lab during the summers. And eventually when I graduated school, I went off to find myself, so to speak, and I went skiing in BC for a year. And when I came home, I started with a large local company, the lab, and I started in their digital department, which was just being headed up around 2007.
Oh, wow. Okay. So that's pretty cool. I got into the digital side around 2007 as well. So in your experiences, what have you observed that have been the biggest impact in the industry that you've seen changing? Specifically dental.
Right. Well, there's quite a few. Now that we're a milling center, and primarily we're milling zirconia as our probably 80% of our restorations currently. What we've seen is tons of changes in basically materials, zirconia itself. Not only the zirconia, but who's making the zirconia. We've seen the aesthetics improve. We've seen different types being, as of late, 4Y, 5Y. Mm-hmm. We've seen translucencies, we've seen strengths, we've seen pre-shaded, we've seen multi-layer, and now we're seeing multi-layer and multi-strength. So for one, it's materials. We've seen a huge leap in what we can do aesthetically with monolithic zirconia and full contour zirconia restorations, and all on four and full mouth restorations just with zirconia alone. Naturally with that, we've seen huge developments on the software side, being 3Shape, as far as getting into ortho, getting the design, basically taking a lot of the tedious work, having their team build it around you just to make your workflow a lot easier, which has helped us immensely on time and accuracy, whether it be from contacts, scanning technologies, intraorally or desktop. We've seen huge leaps on the software side.
Yeah, I agree. It's pretty amazing. And just the intraoral scanners taken off from back when we started. You had to put powder and choke out the patient just to get a good scan in there.
Right.
So what kind of feedbacks are you getting from your clients right now on the materials that you guys have selected?
Well, as you know, a lot of our clients we're just lab to lab. We don't have any clinics. We don't do work for clinics. It has to come through a lab to basically come through these doors. That being said, it's hard for us because often we're missing a bit of the pieces of the puzzles, and we get a lot of questions. Well, what's the best scanner? Mm-hmm. What's the best zirconia? And what should I use? And a lot of the time, the restoration is going to dictate basically the materials we can use, how much clearance we have. Is it in the front? Is it in the back? But a lot of the times our labs are relying on us, but we need more, I guess, we need to ask more questions. We need to kind of get the full facts before we can go ahead and offer something. And it's hard for us to tell them what's best, because often what's best is going to be what they can do with it and how they finish it. We basically provide the service where we're milling the restoration for them and they're finishing it. They're doing the real artwork, and we're kind of more on the manufacturing side of it. But again, we get a lot of questions on how do I accept an intraoral scan, or how do we go ahead and design an all-on-4 with different implants. And so a lot of the time we're trying to work with them and just kind of walk them through. And we don't know everything. We certainly don't. Every day or every week, we're learning something a little more, and things are getting tweaked. And just when you think you know something, we find that either the process changes a little bit, or maybe the CAM or the design makes it more automated. So once we go through all the hurdles, they seem to simplify it. But sometimes we have to go through the trenches to get there.
Yeah, I totally agree with that. I've had a lot of those in the past where you're used to this turnkey solution, and then the doctor took some course over the weekend, and now you have to relearn something that you were kind of a pro with it. So
Right.
I've had that a couple times as well.
And what you alluded to there, we'll have labs who said, well, my doctor went to a course and they're now using this material. That's what they want. And no matter if it's the best material or if it's a good material, we try to get them what they want, kind of a la carte style. We don't just have one type or brand of zirconia or basically material here. We try to keep as much, we let the customer dictate what they want.
Mhm.
And to the best of our ability, we allow them to pick and choose. But it's hard there's so many out there these days.
Yeah, I agree. It's kind of that if you only had one choice, it'd be way easier to do this.
Oh,
But
my life would be simple.
yeah, you just pull one off the shelf and bam, there you go. But that's not what's been asked of us.
No.
So, what advice would you give labs that are looking, for the better zirconia, the better process that you've experienced over the last years?
You know what? It all comes down to technicians. Every company that you talk to is going to tell you that theirs is better than the next guy. And at the end of the day, I've seen low aesthetics, high strength zirconia look better than some of the nicest, most translucent zirconia out there, depending on whose hands it's in. There's a lot of material on all the manufacturers' website for specifics, whether it be strengths, coefficiencies. But at the end of the day, it depends what you can do with it, what porcelain you're using or what glaze you're using, just your processes. My advice is to pick something that you can work with first, master that, and then if your doctor comes to your lab and says, I want this, make sure you know how to do it before you say, I'll get that for you, and figure it out when, ultimately it's ending up in a patient's mouth. So do what you're comfortable with, and on the side you can practice, and then basically walk before you run on all materials and basically anything you're offering.
Yeah, I come across that too, working for lab owners that, oh, so we get this really expensive case and we got to get it done. And it's like, we've never used those implants before. I don't trust it. I don't even have the driver for it. Oh, we'll just order it. We'll get it out the door. And then you read the prescription just a little bit further and you're like, we don't even do this material. Well, we got to get it out the door. This doctor's going to pay right up front. And it's like, I don't feel that that's a wise decision for the customer that ends up getting it, but it happens a lot.
We have to remind ourselves at the end of the day, it's sometimes a thankless job being on the lab side. You also have to remember that this is going in someone's mouth. So, if you need an extra day, and I know it's hard to do that, but you really have to have that communication and expectation management for us, the lab, and they need to have it with their clinic, because if we're running around racing to get something done, rushing it for them, and there's always going to be a rush case. Everyone goes to Europe. We always have that crown that needs to get done. At the end of the day, I rather take the extra time with it and do it once than do it 3 times rushed, because we see that all the time. And, it just makes so much sense, but yet we're always put in that situation. So again, sometimes we just need to take a step back so we can take 2 steps forward.
So I kind of know what you're going to answer on this one now.
Yeah.
If you can change one thing in our little small industry, what would it be?
That's easy. It's time. It's time. It's time. It's time. I think we're gonna have a little more time now, coming out of this kind of pandemic. It certainly let me take a step back from the business. Look at our processes. Look at what we're doing. I'll be honest with you. I've had to relearn basically everything. I didn't even know how to invoice before. So I'm catching myself saying, okay, well, that's why the team was complaining about that, because it's a pain in the ass.
Yeah.
Or, camming something that I haven't cammed in a while, and I'm trying to remember. I'm on the phone with Argon support, which are great, and I'm saying, okay, yeah, of course I remember that. But it allows me to take a step back, look at things kind of with new, fresh eyes, and basically just remember that we're here trying to meet an ultimate goal, and that at the end of the day, it's for the patient. Of course, we have pressure, and of course, if we had all the time in the world, nothing would get done. But there has to be a nice balance between having the correct allotted amount of time to do a restoration, and to see it all the way through. So time for sure, And at the end of the day, I think it's expectation management. If the lab's expecting something and you send something back that's not what they thought, well, that's going to leave a bad taste in their mouth. And now they're going to have to rework what they thought was coming in to get it out, because they're under time too. I know everyone's feeling the pressure. So unfortunately, I don't think it's a simple solution, just give us more time. But I think if we manage the time and if we have kind of a case expectation, we certainly can get a better line of communication, not only with the doctors, but for us with our labs.
Yeah, I agree totally with that. Last question of the day is,
Sure.
We're starting to recover here down in the States. As Canada starts recovering, do you think it's going to be coming back really quick, or more of a slow, gradual return to the industry?
I'd like, I've had my mixed feelings about this. I think, as soon as they let us go, let's rip, let's start milling, let's light up all the machines again, and let's start making money. But at the end of the day, I think that's going to throw me right back into the rush. And I don't think that's going to be the case for us here. I think we're going to really have to slowly open up. There's going to be a lot more restrictions, not only on the clinical side, but basically what the lab can do as well. When you think of a simple example, curbside pickup, well, that's not as easy for us in this industry. Everything we do is a custom piece of work, or an appliance, or a restoration. We can't just leave it on the side of the door and say come pick it up, because we need to communicate. We need to see patients, and so does the labs for shades. As much as I want it to open up and life to get back to normal, I think it's going to be slow to start. It's going to depend on where you are located, in North America and in the world. And I think, unfortunately, we're going to have to just kind of see what happens. The one thing I know for sure is I have no idea what's going to happen in the future.
There's some predictions out there, but again, every day it seems to change. You get new information. There's a new problem that is occurring. So we'll see.
You hear the words COVID-19 a gazillion times a day when you almost become numb to it, because they'll say one thing and the next day they retort and say another. So at this point, I'm kind of just seeing what happens. And when we actually, get there, I'm ready for it. But it's certainly going to be different. And I've had customers come in and labs asking me, what do you think is going to happen? And I'm not too quick to give them an answer. I say, listen, I have no idea. I hope it rolls out slowly and we can get back to our new normal. But I certainly think we're going to see a new normal coming out of this.
Yeah, we've definitely seen it here. So thanks for spending the morning with me. I really appreciate you taking the time to do this, because I know being a one-man show right now, wearing all those hats is a little bit more difficult than we're used to.
No, it's good for me. It's a humbling experience, and I know I've kind of postponed this interview a couple times because I've been out on deliveries, or I've been trying to run to find some isopropyl for the 3D printers. So I definitely am not running out of things to do, but I'm ready for the work to come in when it comes in.
Excellent. Well, thank you everybody for spending the morning with us. Have a great afternoon, and we'll see you again. Okay,
Thanks.
bye.